Good morning, everyone. This morning we are going to elaborate a kind of medical subject which actually is due for all of us to understand. Why we have to understand all these things about medical subjects and medical complications and all that. But you can understand it's a COVID age going on. And this will have very, very profound impact, very profound bearing on our civilization for the next at least 100 years. Today I've chosen two different kinds of medical cares. These two kinds of medical cares are known as palliative and curative care. Palliative care, curative care. Curative care actually goes back all the way to 2300 years when our first doctor on this planet, Hippocrates, were actually treating the people with all kinds of curative agents like herbs and shrubs and metallic and iron and all kinds of chemical acid and every single thing. And that was curative care. Once the patient was treated by the hands of Hippocrates, the patient never went back to Hippocrates for any kind of refill of his medication or check it again and again, second time or third time going for the reports and anything like that. Once you're cured for lifetime. That was curative care discovered by Hippocrates, the first ever doctor in the world. But palliative care is like more recent type of treatment or care found by Dr. Saunders. Dr. Saunders found this palliative care, and the difference between curative and palliative is that curative is actually going to target the crux of our problem, the cure, the core, the total grassroots level region or grassroots level causes will be targeted by curative care. But palliative is kind of suppressive medicine. Palliative is going to suppress all our symptoms for months, for weeks, and again, whenever the symptoms actually rear head, they are going to be treated by doctors like Dr. Sanders, and again they are suppressed. They are not curative, but they are only palliative. So curative medicine is permanent. It can cure all our symptoms, all our grievances, all our complaints. But palliative is like cancer, we can say different kind of other medicines, other remedies are available like diabetes and Parkinson's and Alzheimer's and all that. They are treated only by the doctors, but they are not cured. They are not cured means there are no curative care available, but they are only treated because palliative cares are available. So point number one is palliative care. Another examples of palliative care, all kinds of maladies, all kinds of diseases, all kinds of disorders, all kinds of complaints that we have. Doctors are going to treat them palliatively, not curatively. Mr. Doctor will not be able to cure them, suppress them, put them under control. It's a kind of nocebo. We feel good. We feel like every single thing is hunky-dory. We feel like we are totally cured, but no, we are not cured at all. It's just a superficial feeling that we feel good. Painkillers are given. Disease like dementia, depression, Parkinson, Alzheimer's, cancers, AIDS, MERS, Ebola, Corona, COVID, SARS, and umpteen other maladies are there that we suffer lifetime. But no doctor in the world can curate those diseases. If we want to get the curation of those diseases, we have go back to Dr. Hippocrates 2300 years back, and perhaps he can actually diagnose and prognose properly, and he can actually prescribe absolutely efficacious curative care, and we can actually come out of his hospital absolutely positively cured. But today, unfortunately, curative medicines are very much restrained. There are only very few superficial, like flu and this sort of seasonal thing, and that this can be cured. But look at this corona, COVID, Ebola, AIDS, diabetes, dyslexia, depressions, dementia. They cannot be cured. Absolutely, positively cannot be cured because the palliative cares are available, curatives not available at all. Point number 2 is curative care. Now we are going to shed some light upon curative care. Curative care is like we can say influenza, flu can be cured, tuberculosis, TB can be cured, viruses, some viruses which are not actually astrobiological viruses can be cured, seasonal maladies, stomach virus, biotic attacks, free radicals, infections, inflammations, dysentery, metabolic disorder, chronic headaches, chronic depressions, and something like that, like day-to-day maladies that we go around and pick up from other people. The other people are suffering from some kind of, we can say, influenza, and we pick up that iota of influenza from other people, and we also suffer from that. But take a couple of Advil or a couple of aspirins, and you are 100% cured from flu, TB, viruses, seasonal attack, seasonal maladies, stomach virus, that we have eaten something in the hotel and we have ingested some kind of parasite like hotel parasite, or we have ingested some kind of nosocomial parasites or nosocomial virus from the hospitals, salmonella, listeria. These are the kinds of things that can be actually cured within 3 to 4 days of curative care. So these are the two different kinds of cares. Palliative cares, which actually does not help us to cure anything, but makes us feel that we are cured. It suppresses our symptoms. Only symptom suppressive treatment or care is available, called is palliative care. But curative care is a care that actually expels, absolutely positively expels whatever the virus we actually carry in our bloodstream. And this kind of curative care are very much strained, very much in short supply. So thank you very much for listening. That's all the time we have. See you again tomorrow. Till then, remember, palliative care, curative care. God bless everyone on this planet. Amen.